Hi, welcome to this week's episode of Ask Dr. Jessica. I'm really excited. We have a phenomenal guest today, Dr. Andrew Freedman. We actually get a lot of questions from families about their little children's penises and questions about what's normal. This may sound like a funny question, but I'm hoping just to help people feel reassured out there. A lot of babies, parents are concerned that their child's penises are too small.
Right.
What's your experience? Do you think, and I'll tell you, what I feel, but do you ever, just to let parents know, do you ever feel like that's a real thing? Like how often is there really such a thing as micropenis or a penis that's
Okay.
not
So I'm gonna,
normal,
let me,
not
yeah, let
normally
me,
sized?
let me put this into context. So, uh, I've been doing this for 25 years. Okay.
Okay.
The, I've accurately diagnosed a microphallus, uh, probably 5 times in my career. I mean, it's really, really rare. And admittedly, I've missed one or two because I tend to think everything's okay. But so maybe I have missed one or two, and the endocrinologist caught it. But in terms of really having microfasts, these are really rare. Usually, they're associated with a lot with other significant diseases. So mostly, like for example, a child who has panhypopituitarism, so their whole
Not very
pituitary
common.
system's not working. It shows up. That's where Prader-Willi syndrome. They have other hypotonia, other things that tip them off. Or they have other, they'll have bilateral undescended testicles and scrotum that's really underdeveloped. So a normal healthy kid with normal scrotum and two testicles, truly having just purely isolated um, microphallus is exceedingly, exceedingly rare. What we have instead is an epidemic of chubby babies. And
Mm.
that's what happens. And this is, when I do circumcisions in the office and I see them at 10 days. And I always tell the families when I see them, I say, listen, 8 months from now, this penis is going to disappear. And they're always like, what does that mean? And I say, because when the penis is fixed to the pubic bone, it's attached. The skin and fat is not. So the babies get chubby. And when they get chubby, that skin and fat rides up over the penis. So the penis gets swallowed up and you can't see it. And then the families get really worried about their penis. And they call it an innie or the cave dweller or turtle. You hear all these great, descriptive terms. But they're just chubby babies. And when you push the fat down, the penis pops out and it looks fine. And over time, the penis will grow and the fat will go away and they'll all be fine. And I think, the other problem that we have is I often see kids who are pre-adolescent, right? Who are, that 9 to 12-year-old range, who haven't hit puberty yet. They're 10 or, 1. And they think their penis is too small. These are oftentimes, again, chubby kids. And what I try to explain to them is if you look at the growth curve of your body, it's like this, right? But the growth curve of your penis is that. It doesn't show up that well. There we go.
Yeah.
So the growth curve of your penis is really, really flat
Okay.
until you hit puberty. So when you're 9 years old or 10 years old, the the split between the growth of your body and the growth of your penis is as greatest amount. So you have experiences like, well, why does my 10-year-old's penis look like my 6-year-old's penis? So look at the curve on the chart; they are the same.
Right.
There may be 1 centimeter difference, but this kid's 60 pounds heavier. It's like that's the difference. And so all it's just a matter of is that you have to take into account the size of the penis, not only with their age but their pubertal status, and that they all turn out to be normal in the end. I mean, really, truly having a small penis is extremely uncommon. The other problem that we have is when you ask people to like think of a penis, right? Like get a mental image of a penis.
Okay.
Okay, I guarantee you, it's an erect adult male penis,
Okay.
right? Because we don't think about what a flaccid penis looks like. We don't see, flaccid penises in art. We don't see flaccid penises on TV. So we don't see what a flaccid penis. So everyone's mental picture is an adult penis. Now, the size variance of penises, even for adults, in the flaccid state is a relatively wide range.
Hmm.
In the erect state, it's a relatively narrow range. So all sorts of sizes and shapes, in the flaccid state is really very normal. Some people get more enhancement during erection, and some people get less enhancement during erection. And so but the problem is that they're looking at these little boys. Most people have no idea what these things are supposed to look like.
Right.
They had a very limited experience with them, and they
They're
have this
babies.
mental picture of this, cartoon erect penis. And so it makes it very hard for families to make it feel like normal because, it doesn't help say, well, it doesn't look like dad's. It's like, okay, he's four. He's four. He's not supposed to look like dad's.
So
So,
the jury is out, what you're saying, until puberty, and then most of the time,
well,
by far,
there,
kids are just fine. Or they end up being
well,
just fine.
right. Most kids are fine. If you really want to assess it, you need to push the fat down. If you want to assess the length, you have to do a stretched penile length. So
Okay.
you need to push down, measure from the pubic bone to the stretched out tip. And then there are nomograms to measure that to see if it's within the normal range. So if you have a child who's otherwise healthy, most of the time it really is fine. They're just chubby. If you push the fat away, it'll look like a normal penis. If you're really concerned, it can be measured, and then you can, see an endocrinologist and they can do an evaluation. We don't do it because there's no real surgical options. And all the endocrinologists do is they can give you, testosterone shots to kind of boost it up. Mostly they're looking for, do you have some other underlying, condition
Right.
that this is a part of? But it's really, it's so over. There's so much more anxiety than there really needs to be because we live in a very interesting culture where we're very phallic centric and very phallic concerned,
Right.
but very undereducated about the phallus,
Right. That's
and,
true.
and even more undereducated about the foreskin. So it's like
It's
we're very
true.
worried about something we don't know very much about.
It's very true. No, the common scenario I get is I'll have like a 9-month visit, or somewhere between 6 and 9 months when the kid's really chubby, and I'll see the dad, concerned and really peering over my shoulder when I examine the genitals. And I know what their question is. It's almost always they're concerned that it's too small and where did it go?
Right.
And you're right, it's usually just a chubby baby. I can
Yeah, because they're
reassure them.
expecting it to be this like long, hot dogs hanging off their body, and it's not like that.
It's
It's
not
just,
that.
it's this little mushroom because it's covered with you know, this much penis and that much fat.
Right,
That's the
right, right.
problem.
So now bringing back to foreskin. So you mentioned foreskin, something that a lot of us are unfamiliar with. Just so people can know, how do you recommend cleaning a foreskin? Are there any times you see families where they cleaned them properly and it led to an unnecessary pediatric urology visit? Do you have any advice for parents just for
Yeah,
prevention?
yeah. So keep in mind, for the children who are intact, we have an intact foreskin. The foreskin is supposed to be over the head and tight at the beginning. Everybody has where you can't pull it back, or we call phimosis. That's the normal state. That's physiologic.
Yes.
Over time, the foreskin matures in two ways. That tight ring at the top widens, so it starts to reveal the head of the penis. And inside, that skin is actually affixed to the head of the penis. If you look at it microscopically, it's one layer, eventually splits into two layers. And then it doesn't always split evenly. It doesn't split from the top to the bottom. Sometimes the bottom splits first, and then you see these white lumps. They're not pus. They're not a problem. Those white lumps at the bottom of the head, those are just sloughed off skin cells that are trapped under those natural adhesions, which will mature and separate naturally on their own. The
I'm so
main
glad
thing
you
we
say
do,
that because a lot of parents are
oh,
concerned that it's pus. So
yeah, they're
good.
concerned that I see a lot of those kind of like, listen, like they call me and say, he's got mass on his penis. It's a white mass on his, I'm like, I know what this is. It's a smegmoma, but we try to
I'm glad you have
encourage
a
them.
good sense of humor about all this stuff. It's
Yeah,
good.
you have to.
Yeah.
Well, that's the thing about urology. It's a very intimate field, so you have to have a good sense of humor. But what we tell them is like in the beginning, you don't really need to pull it back. It doesn't need to come back. So you don't want to pull it back more than it is naturally coming. And then it really doesn't really matter what's in the diaper. And the diaper is protecting the head.
Mm.
When
So
they
if there's
are
poop in the diaper, it doesn't matter.
right,
Yeah.
it's protecting it. And then
Right.
you just, you can gently pull gently to see what the tip looks like. But if as it matures and opens up, but mostly when they are toilet trained and peeing in the potty, they should gently pull the skin back as far as it goes back easily, so they're not peeing into their foreskin. So
Hmm.
like if you have a foreskin that's already separated, we don't want them to pee. We want them to gently pull it back so they can pee unobstructed, but also so they don't trap a little bit of urine underneath the foreskin, which can cause itchiness or discomfort, or even lead to infections. So it is normal for a boy with a foreskin whose foreskin pulls back that he's supposed to pull it back when he goes pee and put it forward again, pull it back when they bathe and wash it. Believe it or not, 25% of men are never taught to do this.
Hmm.
And they think it just, happens naturally. So the separation, the maturation will happen naturally. Half the kids will pull back completely by age 3, 70% by age 7, 98% by age 16. That little bit of sticking inside is going to separate naturally over time. But as it pulls back, when they're peeing, it's good for them to learn to pull it back so they're not peeing into the foreskin. And if you want to assess how good the hygiene is of your child's head of the penis, it should feel dry. It should feel like skin. If it feels sticky or tacky, that's just dried urine on it, and then they're not doing a good job of taking care of it. This is for children, not infants. Infants mostly just leave it alone, wash it like an arm or a leg. And the problem is when people force it or tear those natural adhesions, it's painful, redness. Sometimes we worry about it scarring and scarring tightly over the head of the penis. So in the beginning, you just want to be very easy and gentle, wash it like an arm or a leg. As they mature, as it opens up naturally, they can pee. Now, what's the chance they're going to get into trouble? So the chance of having an infection underneath the head of the penis or balanitis is somewhere around 6 to 8% of boys will have an infection. Of phimosis, of getting tight around the head of the penis, again, is about that same 6 to 8%. Half of them will get better with steroid cream. This is the betamethasone ointment. We use that. Half of them get better.
I remember when I rotated with you in residency that you used it so much you had a stamp, right?
Yeah, I had a stamp made to stamp the prescription.
Stamp that prescription of betamethasone. 0.05%, right?
0.05%, absolutely. Twice a day, 6 weeks. It works half the time. So, but then the chance that your child will go on to need a circumcision because all these other, you're having problems and you can't, the phimosis doesn't get better or has a very scarred appearance, or really like, what's the failure rate of a foreskin? The chance of needing a circumcision.
Can you explain what a phimosis is?
So phimosis is where it's tight over the penis and you can't pull it back.
Okay. But
where it's really like scarred and fails therapy, past an obviously at an age when we expect it to pull back, and so where it's really pathologic, where you're having infections, you're having pain, it used to pull back and now it's tight again, where you really are having problems, the chance of that you might need to go on to get a circumcision is about 3%. So for anyone who's sitting there on the precipice of deciding whether to do it or not, the chance that if you don't do a circumcision as a newborn that you're going to need to do it later, it's only 3%. Most people do just fine. Most men with a foreskin do just fine. Most of the world has a foreskin. 75% of the world has a foreskin, and or some of the men have a foreskin, and most people do fine. About 3% will get into trouble.
So, all right. So this is a natural segue into circumcisions because I've seen you do them. And I've also seen you, which I really respect. Just as a surgeon, I've seen people ask you if their child needs one, and you've said no, which I find really admirable, honestly, because I know financially there's a disincentive when you say no to procedures, especially when parents are asking for them. What are your general feelings in terms of parents that want to get circumcised or circumcise their child?
So, all right. So I would look at it this way. So I have a very I've been involved in this since I was one of the task force members for the American Academy of Pediatrics, who wrote the circumcision guidelines.
Wow. Okay?
Yeah, that was like 7 years of my life I'll never get back. But no, it was actually a really great experience. And the guidelines, and this is still the current guidelines that are still supported by the American Academy of Pediatrics, is the guidelines sort of took the approach that, and I support this very much, is that there are some benefits to circumcision, but the benefits are very modest, right? Decreased risk of urinary tract infections the first year of life, certain STDs, although not the ones that are popular in America. So there's like for syphilis and chancroid, which are popular in the third world, but not very popular there in America. And then mostly decreased risk of transmission of HIV from unprotected heterosexual intercourse. But these are very, very small risks and very small benefits. At the same time, circumcision does have risks to it, but those risks are very, very small too. And in a sense, the medical side is kind of a wash, right? So there's never going to be
medical benefit, you mean?
Right. So the idea is that we felt that overall in a sort of gestalt, the benefits were probably more than the risk. But the benefits weren't so much that you needed a universal recommendation, right?
Right.
So it wasn't that it was so great that everyone has to have it.
Right.
And it wasn't that it was so terrible that nobody could have it.
Right.
And the debate rages on, and people keep trying to find a knockout punch medically. And there's never going to be a knockout punch medically. It's never going to be a situation where, oh, this is so great, it's like a vaccine,
Right.
or this is so terrible, like you're, criminally negligent against your child. It's always going to be there's some benefits, some risks. It's basically a wash. So, but we also recognize that most parents aren't really doing it like a medical decision. Some people think of it as cosmetically. Some people it's a very deep-seated religious belief, right? Some people it's their culture of origin and their or family tradition, personal life experiences. A lot of times my father said, listen, I didn't have it. I got it done when I was 14. I'm never let my kid have that chance. I don't care what you say the number is, so there's personal experiences.
Right.
So there's a lot of it goes into it. So I look at it in a nuanced way that if you as the parent who is well informed as to the risks and benefits and is acting with beneficence, right? Who is thinking only about the best interest of their child in the largest context of their child's life.
Yes.
You have a right to make that decision, what you think is in their best interest. And if you feel this is best for them for reasons that are outside of my purview, the non-medical reasons, then we're happy to encourage it and allow you to not only have it, but do it in a safe, hygienic fashion by well-trained providers so it's a safe experience. If you as a parent aren't feeling it, then we want to support you saying it's fine to leave them alone.
Yes.
Because if you're not feeling it, it's not part of your culture. It's not part of who you are. It's not part of your family. I don't want anyone to talk you into thinking that you need to have it. This is not that like last finishing step when, with that the baby has to have. So I'm very supportive of families being able to make that choice and for us being able to, provide them that guidance that, and people say, well, but the benefits outweigh the risk. I said, listen, the benefits, a lot of things outweigh the risk, right?
Right.
But the benefits of double knotting your laces outweighs the risk of double knotting laces. But we don't make everybody double knot their laces, right? Or the benefits of being vegetarian outweigh the risk of being vegetarian. But we're not telling everybody has to be a vegetarian. Now, the HIV benefits real.
Okay.
Not in America, though. I mean, the question is, so this may be a very important global health issue, and certainly in sub-Saharan Africa, but for the U.S. experience, it's actually a very, very small benefit. So, like I said, now the flip side is there are people who feel like on an ethical standard, the highest ethical principle is your right to bodily integrity, right? And so now that's a debate worth having, right?
To leave
debate
the
over
foreskin intact, bodily integrity.
Right. The idea is that you shouldn't change the child's body without their permission.
Yes.
Right. And if that's a debate people want to have, that's a debate worth having. UTIs is not a debate worth having. Your STDs or all these other things. The debate, if you want to have an ethical debate about that, then that's worth having. In the States, we use as our ethical standard best interest of the child. And where it's a non-medical question, we say, well, the person who's able to make that best interest of the child is the well-informed parent. People talk about, well, kids are harmed. Some, in a very small percentage of people do suffer complications. And there's a very interesting article last week's New Yorker about an adult who had a skin bridge and the whole long thing. I'll encourage you to read it. But some people are harmed. But the truth is, parents make decisions all the time that put their children in harm's way to some degree.
Right.
And then they decide whether it's what the benefits are worth it, right? So when you sign your kid up for football, you're making a choice. We know there's some potential risks. We know there's some benefits. And you as a parent make the decision whether those benefits are worth it.
Right.
Or you put them in ski lessons or, they get a driver's license, whatever it is.
Get in the car with you.
That's right. Right. So, the idea that we're letting parents make a decision if it harms somebody, it's like, well, we do that every single day.
Right.
I'm sorry.
And do you, from your perspective, do you see a lot of harm from circumcisions? Like, do you see a lot of kids suffer with, erections in the future, or like where it was done wrong, or too much foreskin was removed? Do you see a lot of complications?
Well, okay, so it's a little unfair to ask me because I'm the tip of the iceberg.
Right.
So anybody with a penis problem is gonna, I'm gonna see them, whereas I don't see, just all the circumcision. I don't have the denominator. In terms of like really significant injuries, we, very, very rarely. Taking too much skin off, extremely rarely. Leaving a little too much skin on so it doesn't look great, yeah, we see that all the time. Skin bridges, metal stenosis. However, we did a study in our office where we looked at every kid coming in for a penis complaint.
Okay.
Okay. And then we looked at whether circumcised or not circumcised, and what the complaint was, and what were the issues, and how we had to treat that. Okay. And so we found that the percentage of kids coming in with complaints um, related to their circumcision was really actually about the same people coming in complaints related to their foreskin. So the idea is there's no having a circumcision is not going to make it so you never have to see me, but it wasn't like they were dramatically more frequent, because there was the same number of kids that had complaints, the same percentage of kids were having complaints because their foreskin, was too tight, or the foreskin didn't open up, or they had an infection. So circumcision was not a cure to the penis,
Right.
nor was it a dramatic risk to the penis. And yeah, do I do revision circumcision? Sure. Do I wish I didn't have to? Sure. But on the other hand, I do circumcision for kids who go on to have problems at 3%.
I think you make some really excellent points. Like the benefit and the risk isn't quite clear to sway somebody one way or the other. And then after that point, you really have to just entrust that a parent will make the best decision for their child, as they do with so many things.
Yeah. And they shouldn't feel so much pressure from other people. They shouldn't feel pressure that that's the American thing to do, or everybody's America. If you look at incidence nationwide, it's really about 50-50 now. If you look at California, it's way under. Only 30% of the kids get circumcised at the birth hospital. Now, some get done in the aftermarket, but it's probably less than 50-50. Even when this was many years ago, we looked at our numbers. I'm about to do this again, where I look at the next 100 kids and see what the ads are. But even when, even here in, West Hollywood, it was only about 65%, 66, 67% of the kids were circumcised. And so it's really, at Cedars.
Wow.
And so it's a skewed
Cedars,
population.
Sure.
Yeah. So I think that we don't need to live in a world where all penises look alike. We can live in a world with a little bit of variety, okay? And so there's no reason that you should feel pressured to do something. Trust your instincts that this is your culture. This is a definitional moment for you. I'm not someone to tell you you shouldn't have it. If you're doing it because you think you have to,
words to live by.
Yeah. If this is something that you aren't, you don't see the need for, and then we are going to support you 100% to leave your child intact. And your child's gonna be fine. They're gonna be fine either way. And I just wish we would debate the real issues.
Debate the real issues. Yes, I agree with that. Whether or not you're saying whether or not a child can make that decision for themselves when they're younger, if it's best to wait till they're older.
At least that's a reasonable topic of discussion, rather than whether circumcision causes prostate cancer. It's
yeah, that's true.
Or prevents prostate cancer. There's articles like that.
That's true.
And so those are, there's never going to be a winner. A winner should be accepting a variety. Accepting that there's right answers. What's right for you may not be right for somebody else, and people should be allowed to choose what's best for them.
I mean, that's a good life philosophy, right?
Yeah. I don't know why that's so hard, but in America, we like to tell people what to do. Tell people that you got my way or the highway.
It's very true. I agree with that. Okay, so a couple last things. So I really like to impress upon parents like what common questions that I get and explain what is normal behavior. So just from your pediatric urologist perspective, so many parents will bring up that their child touches their penis frequently, or a female touches their private area frequently. Is that normal?
Yes. And you know why? It feels good.
So it doesn't mean the character's off, or they're going to be...
It's absolutely normal. And it doesn't mean they have a sexual context, right? So they're not thinking about it in a sexual way, but it feels good. So they play with it, they grab it, they squeeze it. Sometimes they're rough on it, and the girls do it too. And I don't try to discourage it. We just try to put it into context, like, okay, maybe not do this, in school, but it's okay to do this in private, when you're on your own.
Yes. And okay. And if, is there a certain age that's too young when you notice it?
No, not really.
I agree with you. I agree. And what about noticing erections? Sometimes parents will see an erection, a little baby, and they get nervous. That's not normal. What is it your urologist
so there's tremendous so the kids all do have erections. They have the machinery all works for an erection. Usually the concern that we have is parents who don't see an erection. Then they worry, why aren't they having erections? And it's just very variable. Some kids, literally, every time you take the diaper off, if the window's open, they get an erection. Other kids, they never see an erection, but they all get erections, and they all get erections later on. So it's something that should just not be worried about. If your kid gets lots of erections, that's fine. If they don't, that's fine.
I like it. All right, good. So it shows you the machinery is working, but it doesn't mean anything.
Yeah, doesn't it's not abnormal.
Not abnormal. Great. What about any emergencies parents should be aware of? It's such an important area. Is there anything that parents should be aware of when they should absolutely see a doctor?
Yeah, the biggest emergency for pediatric urologists is testicular torsion. That's what the testicle twist. So if your child has sustained testicular pain, okay, so I don't mean that it hurts for a second, or hurt for a minute, but if they're having significant pain in their testicle, particularly if you see redness, swelling, or absolutely if they have testicle pain and nausea and vomiting, that's nausea and vomiting is a huge red flag. That's an emergency trip to the ER. Okay. So now just, if you have pain for 10 minutes and it goes away, that's something different. But if you're having sustained testicular pain, certainly anytime you have pain and nausea, vomiting, that's the big red flag. If you're having pain and say, it's not just like annoying, but or like, oh, it only hurts if I squeeze it really hard. It's not like that. But if you're having really significant pain, they're crying or they have they're complaining, or you see it redness and swelling, we need to get that checked out right away, because testicular torsion is when the testicle twists around its blood supply. It's like your testicle is holding its breath. Okay. If we get to it in 6 hours, we can save it. By 12 hours, it's 50-50. By 24 hours, it's game over. Half of all torsions end up in the testicle being removed. Wow. So that's, usually for delay in presentation. The other thing, the problem is that it's uncommon. So it's about 1 in 4,000. The more common thing is where you have torsion of the appendix testis, like a little nubbin off the testicle, that can twist. That's about 1 out of 400. And sometimes it can be hard to tell, and you might not be able to tell without the ultrasound. So that's why we do encourage people to, take that seriously. So sustained pain, we tell you, if you call, I'm sure if you call the pediatrician, they'll tell you, they're not going to tell you, go take a nap and come back and see if it's still a problem, or call me tomorrow morning. They're going to tell you, yeah, listen, you need to go get that checked out. And most times it involves the ER, but they're really good about getting ultrasound right away. And that's how we differentiate that.
And torsion of the appendix of the testes, that's treated by ibuprofen, right? Just to let
parents know. Right, just rest and Motrin. Right.
Not surgery.
Right. Correct.
That's great.
But the surgery for the testicle, if it's really twisted, is an emergency surgery.
This has been fantastic. I so appreciate your time. Are there any last minute tips of advice that you want to throw out there? Anything I missed that we didn't talk about?
Yeah, I think that, a couple things. I mean, first of all, I really appreciate you willing to talk about pediatric urology, because we don't talk about it a lot. You never in 10 years of ER, you never saw a good urology story, watching it on TV. So I really appreciate the chance to bring it up, because these are things that happens all the time.
Thank you.
I also tell people that, listen, it's always you should feel comfortable bringing up these issues with your pediatricians, because the pediatricians really do know a lot about these issues and are a great resource to start with. So don't be embarrassed to bring it up or feel like you can only talk to the specialist, and that we're here for you. There's lots of us in town, and they're all over the country, and we're here for you if you have concerns. And a lot of times we just provide reassurance, but sometimes that can be helpful. So we're always happy to be here.
Thank you so much. Thank you for all your time. You're really wonderful.
Oh, my pleasure. It's been a lot of fun. I really appreciate it.
I'm lucky to know you. Thanks for taking care of all our patients too that I send you. I really appreciate it.
I really appreciate it. Appreciate your confidence.